There's a Medicare shakeup happening right now that nobody saw coming. And if you're on Medicare or planning to be soon, this could quietly change everything about your coverage options, your costs, and the benefits you've been counting on. A single payment decision just sent shockwaves through the entire healthcare industry. Insurance companies lost billions in market value overnight. Executives are scrambling, and seniors across America are asking, wait, what does this mean for me? Quick question before we dive in. When you think about Medicare changes, do you feel informed, worried, or just completely lost? Drop your answer in the comments, because you're definitely not alone. Here's what just happened. The Trump administration, through Medicare officials, just announced payment rates for Medicare Advantage plans in 2027. And the number, a jaw-dropping 0.09% increase. That's basically zero. Now, you might be thinking, so what? That sounds like a technical detail. But here's why Wall Street went into panic mode. Insurers and financial analysts were expecting increases of 4%, 5%, maybe even 6%. Some companies had already built entire business plans around those expectations. When the actual number came out, chaos. United Health Group, the absolute giant of Medicare Advantage, covering over 8 million people, lost 20% of its stock value in one day. Humana, CVS Health, Elephants, Centene, all of them got hammered. We're talking tens of billions of dollars evaporating in hours. This wasn't just a bad day on Wall Street. This was a warning signal that the rules of the game are changing. Let me put this in perspective. Today, more than half of all Medicare beneficiaries, over 30 million Americans, are enrolled in Medicare Advantage instead of traditional Medicare. Why? Because these plans often come with lower premiums, extra perks like dental coverage, vision care, even gym memberships. Everything feels bundled, simpler, more convenient. For insurance companies, Medicare Advantage isn't just another product line. It's the moneymaker. United Healthcare alone covers 30% of the entire Medicare Advantage market. When payment formulas shift even slightly, it doesn't just tweak quarterly earnings. It reshapes how these companies operate, what benefits they can afford to offer, and whether they even stay in your area. That's exactly why this announcement hit so hard. It struck at the core of a multi-billion-dollar business model. From the administration's perspective, this isn't about punishing anyone. CMS officials, the people who run Medicare, say they're trying to improve accuracy and protect the long-term stability of the program. Dr. Mehmed Oz, the CMS administrator, made it clear the goal is to make Medicare Advantage work better for the people it serves, while protecting taxpayers from paying for things that don't line up with actual medical care. And that brings us to the most controversial change in this proposal, something called risk adjustment. Stay with me here, because this gets technical, but it's actually fascinating once you understand it. Medicare Advantage plans get paid more for sicker patients. Makes sense, right? Someone with diabetes, heart disease, and mobility issues costs more to care for than someone who's relatively healthy. But here's where it gets tricky. Over the years, insurers figured out how to document more diagnosis through something called chart reviews. These are deep dives into medical records that sometimes add diagnosis codes even when those conditions weren't actually treated during a real doctor visit. Government watchdogs have been raising red flags about this for years. The Inspector General's office found that some insurers were getting extra payments for diagnosis that existed only on paper, not in actual treatment records. And they pointed specifically to companies like United Health as major beneficiaries of this system. Now, under this new proposal, that game is over. Medicare will no longer pay for diagnoses found only through chart reviews unless they're connected to an actual medical service. An office visit, a treatment. Something real. CMS estimates this change alone cuts the payment rate by about 1.5 percentage points. And officials were blunt about it. They don't want risk adjustment to be a competitive advantage. Translation: They don't want insurers making extra money just by being better at paperwork. Supporters of this change say it's long overdue. Finally, payments will reflect actual patient care instead of clever coding strategies. Taxpayers won't be overpaying for ghost diagnosis. But insurers? They're furious. The industry group ASHIP warned that this could trigger benefit cuts and higher costs for millions of seniors and people with disabilities. United Healthcare's CEO said flat out, if these rates are finalized, the company will cut benefits and exit more markets in 2027. Their argument? Costs are skyrocketing. Labor costs, hospital prices, prescription drugs, all of it. United Health says it spends 89 cents of every dollar it takes in on medical care. When payments don't keep up with rising costs, something has to give. And what gives? Benefits, coverage areas, plan options. Now, Medicare officials counter that total payments might still rise more than the headline number suggests. Billing trends could add another 2%, bringing the real increase closer to 2.5%. But even that falls short of what insurers were expecting, and it may not cover actual cost increases. That gap between expectations and reality, that's what caused the market meltdown. Here's something important. This proposal isn't a sudden shock. There's a longer story. During the Biden administration, Medicare Advantage rates were already being tightened through risk adjustment changes phased in from 2024 to 2026. The Trump administration kept those reforms, and this proposal continues that direction. So, in some ways, this is just the next chapter in a story that's been unfolding for years. But insurers were feeling optimistic. Last year's increase was over 5%. Many assumed the good times would continue. When a number near zero came out instead, it felt like betrayal. That emotional whiplash matters, especially in markets. Okay, let's bring this home. You're sitting there thinking, this all sounds serious, but what does it actually mean for my Medicare? Short term, nothing changes immediately. Your benefits for next year aren't suddenly disappearing. But longer term, this could reshape what plans look like, which extras are offered, and where insurers choose to operate. You might see fewer flashy perks, more focus on core medical coverage, tighter networks. Some insurers might pull out of certain counties entirely. On the flip side, some people actually welcome tighter oversight. If it means payments reflect real care instead of paperwork games, that's a win for program integrity. At its core, this whole debate is about balance. How much should the government pay private insurers to manage care for seniors? Too much, and taxpayers overpay. Too little, and insurers pull back, reducing choice and benefits. The Trump administration seems to be saying Medicare Advantage needs to be carefully calibrated, not treated like a growth engine driven by Wall Street expectations. And that's why this caught everyone off guard. It challenged an assumption that Medicare Advantage payments would keep climbing steadily. Here's the important part. This proposal isn't final yet. CMS usually finalizes Medicare Advantage rates in early April. There's still time for adjustments as more data comes in. And you better believe insurers are lobbying hard between now and then. The big questions are, how will insurers respond? Will they quietly cut benefits, pull out of markets, find new efficiencies? And how will CMS respond to all the pushback? What we know for sure is that Medicare Advantage isn't going away, but it may be entering a more restrained, more carefully monitored phase. If there's one takeaway here, it's this. Even a tiny number like 0.09% can signal a massive shift. This isn't just about stocks or insurance company profits. It's about how Medicare evolves, how your taxpayer dollars are used, and how care is delivered to millions of Americans who depend on these programs. Staying informed, even when the details feel overwhelming, puts you in a better position to make choices that actually fit your life and your health needs. So here's what I want you to do. If this video helped you understand what's really going on, hit that like button. Subscribe if you want to stay ahead of changes like this, and drop a comment. Let me know. Are you on Medicare Advantage, traditional Medicare, still figuring it all out? Because these conversations matter. Your voice matters. And together, we can cut through the noise and get to what really counts.